This is the Emergency Medical Minute, sponsored by Health One.
So Ebola's in the news quite a bit the past few weeks. It's been in Congo for actually a couple months, and it's the second biggest outbreak apart from the one a couple years ago, mostly because there's been a civil war and a lot of the healthcare workers have been attacked. The rebels especially have attacked facilities and healthcare workers, and they've been very pushing against the treatment, the burials, and now it passed into Uganda the past 2 weeks. They've had a couple cases now. They had 2 people die. Uganda actually responded really well. They have a pretty porous border with Congo, so they kind of clamped down on the border, and they actually used the vaccine. They vaccinated over 5,000 people in the past few weeks, and they've had a really amazing national healthcare response. So it's really a success story of how to treat and clamp down on Ebola. Does anybody know the symptoms of Ebola? Vomiting. So it's basically like the flu. Early on, it can look just like a cold. That's why they missed it in Texas when it came to the U.S. So flu-like symptoms, and then they just kind of turned deathly sick with bloody diarrhea, bloody vomiting. Does anybody know how you get Ebola? I know we go into the spacesuits whenever there's any possibility of someone in there. It's mainly contact, yeah. And you have to be a lot closer than just shaking hands. You have to be have open, broken skin, or get, basically their secretions in your body somehow. So the biggest people who are at risk are who? Healthcare workers, yeah. So someone who's in very, very close contact. It's not just from shaking somebody's hand or saying hi. It's really those high risk close exposures. Some of the U.S. people who were working in the Ebola crisis who got it, they were delivering babies, weren't able to put on their PPE right away. Just emergent situations. So travel alerts are important. When they're traveling to Mexico, that's probably not going to do it. But of note, the past month or so, there has been tons and tons of people from Africa going into Mexico to cross the U.S. border. Probably about 5,000 to 10,000 Africans have showed up at the U.S. border in the past month. So just think about that too. So thanks.
Hello, Emergency Medical Minute listeners. This is Nancy Lorenzon, faculty in Biological Sciences at the University of Denver and pre-health advisor for the university. I want to tell you about an awesome event that we're hosting later this month. On November 21st to the 24th, clinicians, educators, policymakers, and community will gather at the University of Denver for the first Colorado Behavioral Health and Wellness Summit. The intersection of mental health and substance use continues to be a challenge in the state of Colorado, as you know. The University of Denver, the Mental Health Center of Denver, and Envisionio join forces to create the summit as we share a collective commitment to encourage neighbors, friends, family, and colleagues from all around Colorado to learn more about behavioral health issues and substance use disorder. At this summit, speakers and presenters will engage our community to break down silos statewide and to bridge gaps in communication and collaboration. The summit will provide various audiences with approaches to awareness and education, training and clinical practice, and policy, advocacy, and action. Participants are able to discover new tools and resources, discuss practical strategies for change, and connect with colleagues and experts. We hope this community collaboration will foster an increased focus on tackling these difficult issues. The event is free and open to the public, and we hope you all join. For more information, please visit our website at portfolio.du.edu/CO Health and Wellness Summit, or you can contact me at nancy.lorenzon@du.edu.